You're recognized.
Thank you, Mr. Chairman. I want to thank you and Chairman Winstrup for your work and the work of other committee members on this draft legislation and the work of your staffs and the minority staff as well. This is, I think, one of the most critical issues for us to be working on, and I appreciate the feedback from the VSOs and Mr. Steyer and the VA on this. And whatever imperfections or improvements that can be made, let's get to them as quickly as possible. And I hope that the VA, and it sounds like from some of your comments, Dr. Clancy, you are, I hope the VA will run with the spirit of this, and whatever you can do administratively now, do it. Don't need to wait for legislation from Congress to do so. Last summer, we learned that there were 41,500 medical positions authorized, appropriated for, but unfilled at the VA. What is that number today?
Congressman O'Rourke, we do have the number of requirements that have been initiated in Web HR. We don't have a precise number of vacancies due to the fact that we don't have a position management system in the organization, but the number is currently 43,000 positions. And out of those, 37,176 are actually on the active recruitment phase.
Okay. So if, I'll just take from your answer, if we were at 41.5, we're now at 43. Okay. So we're having a really hard time, not even treading water, but just not sinking altogether. How many of those 43,000 are behavioral or mental health positions?
I have the numbers here. Let me just find it real quickly. There are 3,497 physicians, close to 9,000 nurses. I have some specific numbers related to mental health, which will, there are psychiatric, there are about 3,200 of those positions. Well, let me rephrase that back. There are 3,216 on board psychiatric. There are 275 actions in the Web HR system being recruited.
How many psychiatrists are you short?
I don't have that specific data in front of me, Congressman O'Rourke.
So this is a request I've made of the Secretary already, and I'll make it again through you, Dr. Clancy. I know the Secretary has a 12-point program to turn around the VA. I will again submit it should be a 13-point program, and point number 1 should be reduce veteran suicide. If we do that, we're going to make decisions, including hiring decisions and decisions on where we prioritize accordingly. And we will know how many psychiatrists and psychologists and social workers short we are. And I think we'll make some decisions about how we prioritize their hiring. I shared with you, Dr. Clancy, that we are at 89 FTEs, full-time equivalents, in El Paso for mental health today, with 116 authorized and appropriated for. And we are at a 2- or 3-year low for mental health providers. And we know that care delayed becomes care denied and results in some tragic outcomes, including veteran suicide. So I want to use this forum again to ask that we prioritize that. Within this bill, I'm encouraged to see provisions for market pay. My only concern related to that is that perhaps in El Paso, which is not a rural area, but an underserved area, and then you have rural underserved areas, we may need to go far above market pay to get the number of psychiatrists, psychologists, behavioral health providers that we need. And so that would be a change that I would ask for. Pay whatever it costs to get the appropriate person. Understand that American medicine generally is having a hard time producing psychiatrists and psychologists and mental health specialists, but there are people in Manhattan who are able to go see a psychiatrist about their dog urinating on the carpet. There should be veterans who are able to, suffering from PTSD, who are able to see somebody immediately without any question. We just need to do whatever it takes. And Mr. Steyer, I have to tell you, I really appreciate your comments about this being perhaps the starter pistol. And what is really needed ultimately is accountability and oversight. And for the record, would love for you to tell us what you specifically recommend for that to ensure that we're following up on this. Because it can't just be look, this stuff is hard. We can't hire these people. It's hard in American medicine. There have to be some consequences if there are new authorities and resources given to get the job done and to prevent veteran suicide and provide greater access for mental health. So sorry to make a speech and not ask as many questions, but I would like the direct answers to those questions I asked of you, Mr. Hernandez and Dr. Clancy.
We will get you that information expeditiously. I'm going to presume, just to clarify, that getting the full spectrum of people who, professionals who provide mental health care is what you would like, the social workers, psychologists, psychiatrists,
Nurse
and so
practitioners,
yes.
everyone involved in the provision of that care so that we can connect veterans who need it, who aren't receiving it today. That's what I'm looking for.
We will get that to you expeditiously. I will also just insert for one moment that we are exercising all of the incentives that, thanks to the Congress, were provided in the Clay Hunt bill as well, because we agree with you, whatever it takes. This is an imperative. And one other thing, one of the Secretary's 12 breakthroughs actually does include a component on suicide. It is not explicit about the hiring piece, but to do it right, we've got to have the hiring piece as well. So that message has been heard.
Thank you.
Dr. Abraham.
Thank you, Mr. Chairman.